Hello, my name is Ola Dryling, and I want to talk to you today about the research I have conducted regarding PCOS, which stands for Polycystic Ovarian Cyst Syndrome. I just wanted to talk to you about that today as I did my research paper on that, and there were two articles that I researched, which gave me information regarding the condition even more so than what I've already have known before. PCOS is an Anderson syndrome and affects many women worldwide. It causes many symptoms and may be hereditary, and is formed and identified during puberty. PCOS has cysts that form on the outer parts of the ovaries during puberty, which causes the estrogen levels to decrease and the androgen levels to increase, increasing testosterone in the female body. From a biological perspective, the condition does present some serious concerns, as doctors do not have the exact cause, but they do know some of the persisting conditions, which include excess of insulin, which is a hormone. These symptoms include irregular periods. It is not common for women to get periods all the time when they have PCOS. They skip months at a time. Other symptoms include just hormonal imbalance and obviously cysts around the ovaries. In the large, in these ovaries with the cysts, they contain large sums of small fluids which surround the eggs. Furthermore, with PCOS, it is a major contributor to infertility and presents many challenges in being able to conceive and during pregnancy. PCOS has been known as the most common endocrine disorder of the female body within the fertile age. There are also an increasing body of evidence that pregnancy complications such as miscarriage and gestational diabetes and preeclampsia are possible, and premature delivery are the most common and frequent side effects with PCOS. So in my first research article, the study was conducted to determine the level of depression which was greater in women who have PCOS. As research studies have conducted that a lot of people with PCOS, a lot of women who are affected by PCOS suffer more from depression. In the preliminary study, it had suggested that 28 to 64% of women with PCOS showed symptoms of depression. The cause of high depression symptoms in women might be intricate, with some studies show that physical symptoms are a possible reason for the psychological disorder. In this research study, the method used was a comparative study performed that studied 174 women, and the breakdown was 58 women who were identified of having the symptoms of PCOS, and the remaining 116 women who were healthy with a good social background and good lifestyle and healthy patterns. Depression was assessed by the Beck Depression Inventory System. The mean was estimated in both groups and investigated the similarities between the two ranges. The results showed that the mean of depression score in women with PCOS was higher at 30.31, which was significantly more than those who did not have the condition. The results indicated that women with PCOS have a higher risk of suffering from distress and entering into depression. These studies concluded that women who suffer from PCOS also are prone to carry some form of mental disorder, whether it be depression or anxiety or something along those lines. In the second article, the analysis was to determine the sex ratio and complications according to the mode of conception in women with polycystic ovarian syndrome. The investigation in this research article was the pregnancy complications and offspring of the sex ratio according to the mood of conception in the women with polycystic syndrome. During the study, a total of 176 women who were diagnosed with PCOS participated in the study. The method that was used was with the PCOS was who had the participants in one or more clinical studies were invited to answer a questionnaire on the mode of conception during pregnancy. Complications of a total of 139 women responded. Data were qualified checked against hospital files, and the results showed more than half, which was 54% of the singleton pregnancies, were conceived spontaneously. More complications were seen in pregnancies achieved while using metformin than without. So in this study, they compared women who took metformin for some of their PCOS conditions, which most likely is to regulate their insulin level. Compared to spontaneous conception, more boys than girls were born in this pregnancy with women who had the PCOS pregnancy type. With all this, the reason why I chose to do this research project for this, for my final in this course, was because I myself have polycystic ovarian syndrome, and I have learned about it when I was 20 years old. And since then, I have been on a very interesting journey as far as medical procedures and different health options and lifestyle options, such as eating better, eating healthier, not eating so many fatty foods, not eating things that the body cannot process, would help reduce the risks of obviously having just complications with pregnancy. It is one of my goals and my heart's desire to be pregnant now that I'm married, and so this was interesting for me to do, as it gave me some more insight of what I should be doing to conceive. So I do believe in God, and I do believe in His healing power. So with His strength, I do believe a miracle will happen, even in a sinful, fallen world and the challenges we face. Thank you very much. Hello, my name is Olga Dreiling, and I'm doing my research project on the effects of polycystic ovarian syndrome.